Of the statewide closure of all drive-through PCR testing clinics. The closures are part of South Australia's transition to removing all PCR testing facilities by January the 8th.
This is breaking news today, and this is very perplexing. Because in 2020, 2021, testing was mandatory because you needed a negative test before you could go to places or even travel across the city. Millions of people were spending 3 and 4 hours and sometimes not even getting there before it closed in these queues to get tested. And all states and territories had these laws and orders, and here's the one for South Australia in 20th of July 2021. This testing requires they're tracking the movement of every single case because it was a pandemic emergency, where if you look at South Australia there in the middle, they had 807 cases and only 4 deaths, and this is by July 2021, more than a year into the emergency. Now, 807 cases over that period works out to about 13 to 14 cases each week. So in the week they've been scaled back testing, there's 9,986 cases in 1 week. It's an increase of a factor by 700. That's 700 times the number of weekly cases from when they had mandatory testing and people were lining up for hours. In the midst of the emergency in July 2021, South Australia had 0 cases in hospital, 0 in ICU. And this week when they're scaling it back, they got more than 100 people in hospital, and they've had 35 deaths in 1 week when it had only 4 for 14 months.
The state's Chief Public Health Officer, Professor Nicola Spurrier, says the decision is due to a plateau in COVID-19 case numbers.
Oh, that explains it then. Like there's 700 times the weekly cases and many times the deaths, but they've plateaued at those levels, so therefore it's okay. It's just not continuing to go up. It's not coming down. They didn't say it's coming down. It just said it's plateaued. Fuck it hell. Now, striking as the mystery in South Australia is, it's actually Australia-wide, this PCR test changes. You might be thinking, good, the Aspen Medical gravy train of being paid hundreds of millions of dollars for PPE and PCR tests is coming to an end. But there's a bit more to it. So you're going to need a referral to obtain a PCR test. Sure, they can scale back the testing and maybe not as available, the demand isn't there, but why put an obstacle to getting a PCR test? That's a significant control measure on the general public getting the results of these tests. It's a strange government policy to introduce, particularly when government media is reporting COVID cases set the surge with uncertainties to continue.
Officials in 2 Latin American countries alerted the WHO of several outbreaks of a new infectious disease that's mysteriously appearing across the region. Severe Epidemic Enterovirus Respiratory Syndrome 2025.
This is the latest equivalent of the Event 201, the simulation of a pandemic that occurred in November 2019, the month immediately before COVID first burst onto the scene. So could it be the big surge in respiratory problems that coincide with you-know-what? Are they going to give up on the variants of COVID and introduce a brand new one, which of course would then mean a brand new emergency? Because COVID-19 is essentially just a name and a label slapped to cold and flu symptoms. They're going to stop people from testing for the label that they've been using, and they're going to switch in the Sears label. You can go and get tested for that. And that you'll have to line up for.
The virus could cause a severe pandemic if early containment and mitigation efforts are not successful.
Go over to Rumble and type in Bohemian Style if you want to find a lot of good information. This is where I got this from. All right, that's it for this one.